to McLean. My name is Dorothy Villano, and today we'd like to share vital information, tips, and resources about osteoporosis and arthritis. May is National Arthritis Foundation Awareness Month and National Osteoporosis Prevention Month. And in honor of those two events, we are here today to share vital information that you can use regarding how to live healthy lives with osteoporosis and arthritis. Today we'll be meeting Mary Johnson, an occupational therapist who specializes in arthritis awareness and using adaptive equipment in the kitchen and in your home to help you avoid stress and strain to your joints while you work around the home. She will also be talking about driving safely. And down in our fitness center, we'll be meeting Carol McLeod, who's an arthritis fitness instructor. She'll be sharing information about how to manage arthritis by using exercises designed by the Arthritis Foundation in the warm water pool at McLean. We will be also taking a look at our land exercise sponsored by Silver Sneakers. It's a land-based exercise program that involves chair and standing exercises that are ideal for helping people with osteoarthritis improve their strength and posture and balance. And last but not least, we will be talking about osteoporosis and how you can safely exercise with osteoporosis to lower your risk of fracture.
My name is Mary Johnson. I'm an occupational therapist here at McLean, and I wanted to talk a little bit about managing arthritis. We all know that so many of us experience symptoms from arthritis, and that includes pain and can include joint swelling and even deformity. And part of what we have to do in life is to manage arthritis. We can't fix it, we can't cure it, but we can manage it and learn how to live with it. And we want to do that in order to reduce our pain and increase our function, but also to protect our joints so that the integrity of the joints are preserved for as long as possible. And a lot of that can be done during our daily tasks every day. The kitchen is an area that requires a lot of use of our hands, use of all of our joints, and can also be a problem area for people. So we're going to talk a little bit today about some joint protection, but also adaptive equipment, or gadgets if you will, that allow us to use our hands and our bodies in the best way possible. First of all, in terms of joint protection, we have to think about the fact that using our larger joints to move things, to carry things, will protect our hands. For instance, if we are carrying a purse, such as this, we don't want to do it this way, because what we're doing is putting our hands into a very vulnerable position. Anything that moves your hand toward your baby finger can, especially with certain types of arthritis like rheumatoid arthritis, can really increase your chances of having joint deformity. So rather, we want to use our larger joints, for instance, the elbow or even preferably the shoulder, to carry a bag. If we're opening and closing cabinets and drawers in our bedroom, we want to try to use our hips or our bottom to push things in rather than using our fragile fingers to do an activity like that. Even when we're mixing something, for instance, in the kitchen, we want to use this kind of a grip rather than this kind of a grip, because as you can see, it's forcing my hand to go toward the baby finger again. And also, using this kind of a grip is going to give us more power. Again, we want to use our larger joints to do that work, and it's going to provide less stress to the weaker joints. And using any kind of built-up handles can be a real boon to people who have pain in their hands or have deformities in their hands or just have weakness. For instance, even using something like a peeler, and nowadays you can get these kinds of ergonomic handles just about everywhere. You don't have to go to a special store or catalog, and that's wonderful. Again, we want to do things that use our joints properly, and pushing rather than pulling is going to help with that. So when we're peeling, we want to be going this way, okay? And again, trying to use that mass grasp rather than turning our hand. We want to try to do things in this direction. This one, actually, you'd probably want to go like that. Opening jars is a huge problem for many of us, just to get it done. But also, it requires turning your hand this way. So using something like this jar opener can really help us. We still might have to turn a little bit this way, but we're using our bigger joints to do it, and a lot of the power is coming from the device rather than trying to do it with our hand. Even something as simple as a mug, you know, getting mugs with larger handles, even one larger than this, so you can slide your hand in and hold your mug, again going toward your thumb, rather than holding like this, might help with the hand. You can get cylindrical foam that can be used universally on a lot of different products, even your toothbrush, your comb, or a utensil in the kitchen. This one is rather narrow, but you can get them of all different widths. And you can just wrap that around a utensil, or you can slide it on. This one has a hole for sliding it on. And again, anything that gives you more to hold on to is going to be easier, and anything that avoids a strong, firm grasp is going to be better for your joints. This is just an example of a utensil that could be used with that comes with a bigger grip. Or even for some people, especially with more advanced arthritis, doing something like a button can be really difficult. Now, obviously, we can avoid clothing with buttons. We can use larger buttons. But you also can get things like a button hook, which is kind of magical when it comes to opening a button or closing a button. And many of these items, I have to say, you don't necessarily want to just go out and buy them. You'd be very wise to consult with an occupational therapist who is knowledgeable about arthritis, who knows you personally, and can help you to kind of make some decisions about which things, if any, would be helpful to you. Another thing is carrying things, for instance, from the stove. Something like this pan or pot, if you can hold it with two hands, like this, at support underneath, that's going to give you, again, using your stronger joints, it's going to give you a lot less stress on your smaller joints. And that's true of anything that you carry. If you can try to use both hands and keep one hand underneath the item, it's going to help. The other thing is prolonged positioning. You don't want to stay in one position for a long period of time. That can even mean sitting. You want to move around as frequently as possible. But for instance, if you are sitting, one thing that you want to think about is how do you get up? And obviously you want to get to the edge of the seat, but then you want to put your hands flat on the armrest of the chair and push up like that, rather than doing something that would put pressure on your gentle, small joints of your hand. The other thing that we often do for a prolonged period of time is talk on the phone. And that can really cause problems for people, not only for their hands, but also for their neck. So you can avoid that by how you hold the phone, but also maybe using a speakerphone or using the phone that gives you a place to support your head rather than holding it in your hand. If you do have to hold it in your hand, however, I would recommend that you not do this, okay? Try to hold it in such a way that you're not, perhaps like this, so that you're not doing a firm grip for a long period of time, and again, you're not moving toward that baby finger. The other area that can be problematic for people with arthritis is driving. And here at McLean, we have a driving rehabilitation program, and sometimes just getting in and out of the vehicle or operating the controls in the vehicle is most problematic for people, so we do address that. There are many, many devices now on the market, some of them very inexpensive for getting in and out of the vehicle. There are special cushions, there are special grab bars that you can put on the door frame or in the door frame that can help you get in and out. Luckily nowadays there are also vehicles that have six-way power seats and things like that that can accommodate people who have difficulty with arthritis. Once in the vehicle, though, there are also other things that can help you. For instance, you can get padding for around your steering column, which can really help with not gripping the wheel tight or gripping something hard. You can get something softer and foamier. You can also get many different kinds of extensions for the ignition key so that it's much easier to some people. That's the hardest thing they have to do is just turn the key in the ignition. And if you get an extender, it really makes it a lot easier.